evening and welcome to Money Matters. My name is Charlie Huntington and I am Public Relations Chairperson for Life Sciences Pennsylvania. Life Sciences PA is the voice of advancement for Pennsylvania's bioscience, medical device, CRO, and healthcare IT industries. Tonight, we continue our special series on science leaders in our local community. But before we do so, I want to remind our viewers that from time to time, financial issues relating to life sciences, healthcare, or technology matters may be discussed on the show. These discussions are not and should be not viewed as financial advice. Moreover, since the program is pre-recorded and shown at a later date, please keep in mind that the information may no longer be current. You should always check with your financial advisor before entering into any financial transaction. I'm pleased to have with me as my co-host, Kimon Hatza. Kimon is a business attorney and partner at GrowthCounsel LLC in Philadelphia, Pennsylvania. His focus is in the life sciences, healthcare, and information IT information technology areas. Welcome, Kimon.
Thank you, Charlie. Good to be here.
Kimon, as you know, and our producers know, this is our last show. It's been 89 shows over the last 15 years, and I loved doing every one of them with you. And you were really a consistent and humorous, and more importantly, you brought knowledge to the room that I certainly would never be able to bring to the room because of your practice. I just wanted to get your impressions and look back for a minute or two over the last 15 years and have you tell our viewers what the show's meant to you.
Sure, I appreciate that, Charlie. Boy, it has been quite a run. I can't believe it's 15 years. And when we got started, I really didn't know you, Charlie. I was introduced to you by my former law partner. And over this 15-year period, we've become really good friends. And I'm appreciative of that. That's probably my favorite takeaway from the show. But in terms of the show, the substance of the show itself, I mean, I thought of some of the humorous things that happened in the early days when we were trying to work out the kinks. We introduced sort of a new format to the show, and the producer was willing to let us give it a go, and it turned out to be extremely popular and to get a lot of hits on his YouTube site. And now when I look back, and I look at some of the other hosts now, the format of most of the shows today are more like what we've basically pioneered over the last 15 years. We've had some terrific guests on the show. Really, it's been a who's who of the regional life sciences ecosystem. It's been an amazing group. I think of some of the funny things, like not so funny. And we've been in 3 different studios, and then when the pandemic hit, we started doing it virtually like this. But I remember when a beam almost fell on one of the key players in the industry.
2 by 6 almost took out one of the crazy.
Yeah, and we had a couple of guests go rogue and talk about things that they shouldn't have spoken about, and a couple of other things over the sound problems in the Army crawl. I won't even get into the details there. But,
oh my gosh! Yeah.
But it's been overall. I mean, what I come away with is just the depth of expertise and the richness of our region in the life sciences and technology spaces. It's just amazing to me. And we've done 15 years with maybe 1 or 2 repeats at the most in terms of guests. I mean, we really had a different guest. That's how rich, our area is in people with this kind of expertise, and I think that's pretty amazing. Yeah.
Well, Kimon, you said it. My favorite thing has been our close association and building that relationship. The favorite interaction with guests is always tell us outside of work, sort of what do you do, what are you into, and we've had private pilots, cookbook authors, alpaca farmers. I mean, I could go on for 15 minutes. And anyway, it's been perfect. It's been a great way to get to know members of the community and feature what I think is part of the best businesses in our region. So thank you. And thanks to our viewers for giving us the opportunity to do this. Before we introduce our very special guest, I want to remind our viewers for future shows, here's how you could get your question answered.
You can have your questions answered on Money Matters. Please go to our website, money-matterstv.com. On our homepage, click on the banner on the right that says, Send us your questions. While you're on our website, you can find information about our host and guests, as well as show notes and links about this show and past shows. Money Matters is also available as a podcast on iTunes and Stitcher, so you can listen to Money Matters while you're on the go. That website address, again, is money, M-O-N-E-Y, -matters, M-A-T-T-E-R-S, TV.com.
It's my great pleasure to introduce Rick Ward. Rick is a proud alum of Penn State University, where he majored in marketing. After initial jobs out of college in chemical and hospital sales, he worked in various roles of increasing responsibility at Veritas Medicine, Parexel International, and Metavante, ultimately becoming vice president of business development at Greenfire, the industry's leading provider of clinical payment solutions. After playing a key role driving the commercial growth at Greenfire, which would eventually lead to a highly successful exit to private equity, Rick worked as VP of Commercial Operations at Trifecta Clinical. He was also the Senior VP at Clue Points, where he played a central role in orchestrating another successful exit to PE. Rick is presently the Chief Commercial Officer at CRIO, a health technology company helping pharma biotech research sites and academic research centers streamline workflows. Rick has been an advisory board member at Society for Clinical Research Sites, a youth lacrosse coach for many years, including 3 years when my middle son, Braden, was a part of his team. He claims as his father-in-law, Frank Maffei, who is the last surviving member of the South Philly rock band Danny and the Juniors, who had #1 hits, including At the Hop and Rock and Roll Is Here to Stay. Rick, welcome to the show.
Charlie, thanks. It's a pleasure to be here. A lot of pressure after 15 years, but I look back and think it was probably wise to give you guys a decade and a half to work out the wrinkles, and I expect this one to go quite smoothly.
It's going to be easier than being a man down in lacrosse, I promise. So, all right, tell us how you went from majoring in marketing at Penn State to becoming a sought-after executive for private equity-backed firms in the clinical research space.
Yeah, it's interesting. You mentioned being a major in marketing, and many business colleges then and today don't really offer majors that clearly focus on sales, yet sales is a career path that a lot of businessmen and businesswomen pursue right out of college as they work into different parts of the business world. And I majored in marketing, but I came right out of college and started in sales and business to business sales. And I, at one point, kind of found myself in the clinical research industry, which was a space I wasn't familiar with, but found it to be rewarding and exciting and interesting, and have been in it ever since. A little over 20 years now, with the last decade plus really gravitating towards your more entrepreneurial, technology-focused companies within this space.
Can you describe for our viewers CRIO's technology in layman's terms?
Yeah, happy to. So the context that's required is when I speak of the clinical research space, which is within the pharma drug development world. The basic concept to be familiar with is that when pharmaceutical companies, biotech companies are developing new drugs, specifically when they get into clinical trials, phase 2, phase 3 clinical research trials, they're soliciting the involvement of physicians, which within clinical research we call investigators. So these investigators are all over the country, all over the world, participating in clinical research, essentially by collecting a lot of data after enrolling the appropriate patients into the clinical trial, ensuring that they've been given all the information they need for their protection, and then collecting, again, a lot of data, which ultimately feeds into proving whether or not the investigator drug is safe and tolerable, as well as effective, and moving it through the clinical trial process. And so it's a very large dispersed sort of machine in working with all of these investigators to conduct clinical research, and CRIO's technology is essentially used by these investigators to support a number of different workflows and make clinical research a little bit more efficient, a little bit more manageable and scalable.
Rick, where did the company's name come from?
Yeah, CRIO, CRIO. Interestingly, the gentleman who's one of the founders initially took the clinicalresearch.io URL. So the IO came from clinicalresearch.io. But as you imagine, that's a bit of a mouthful for a company name. So as the company grew and expanded, they sort of abbreviated that down to CRIO. And we still use that URL. Our email addresses are all at clinicalresearch.io, but we're a little bit better known in the industry now simply as CRIO.
Rick, I know that you have competitors in your industry. I was wondering how CRIO distinguishes itself from its competitors.
Yeah, we certainly do. I mean, that's one thing about this technology space, even within clinical research, is there are various companies that are trying to tackle some of these challenges in slightly different ways. So we do have competitors. Specifically, if you think of CRIO in the way in which we support investigators, the physicians that are conducting clinical research. There are other companies that also have developed workflow tools for these investigators. Where I think CRIO is different is that our solutions have become so widely adopted and scalable that we're actually now partnering directly with the pharmaceutical companies, the biotech companies, the organizations that are running the clinical trials in order to scale the technology even more effectively. And there's a number of downstream benefits in terms of data quality, patient safety, speed, and cost of running clinical research. But that would be sort of where we differentiate the most is our ability to not only continue to support the investigators directly, but also partner strategically with the pharmaceutical companies.
As you look at the pharmaceutical industry today, would you say that the service that you provide is a must-have for pharma companies or a nice-to-have?
Yeah, no, it's a great question. We talk a lot about that because here at CRIO, and this is true for some of the other technology companies I've worked for as well, we become so passionate with the mission of what we're doing that we start to believe that it's almost like a no-brainer. Like, how could any organization not want to partner us? And there's a lot of passion involved in the company. So you start to almost feel like what you're selling is a must-have. But realistically, CRIO, and again, most of the companies I've worked with, are bringing innovation to the market. So there is another way to achieve certain things, which, as long as that's true, arguably we're a nice-to-have. You know, you can run a clinical research trial and you can run a successful one without CRIO. So it's upon us to really convince the market and demonstrate to the market through case studies and proof that, yes, you can run that same clinical trial more effectively, perhaps safer, faster, for less money, with partnering with CRIO. So we are still squarely in that nice to have category. But what's fun is, as I've seen with companies like Greenfire and Clue Points and some of the companies I've been with, that as you begin to build that market adoption and that enthusiasm around the benefits of your technology, you start to become a little bit more of a must-have. But that takes some time, and this industry does take some time to adopt new ideas. So for now, we're still kind of a nice-to-have.
Okay. Who are your customers really? Who are your customers and clients?
Yeah, another good question, because when I say we work with pharmaceutical companies and biotechs, some of these organizations are very, very large. There's huge sides of the business that are involved with marketing and of approved drugs. We deal more with the R&D drug development side, but even within that arena, you're talking about sometimes very large organizations. And what's tricky about what we do is that the value we bring doesn't sit squarely just in sort of one department. So for example, the data management organization, which is focused on clean data, quality data, fast access to data. There are specific things that we provide that really benefit that group. However, there's another group within pharma that sits in a silo far down the road, that their responsibility is investigator engagement and relations. How does the pharma company reach out and engage with the investigators in order to partner with them and collaborate with them and be sort of a sponsor of choice, so to speak? Those folks may not often talk to the data management folks, but we have another set of unique benefits to them. So part of the tricky part sometimes is bringing bridging these silos together within an organization to help them collectively see the full benefit of partnering with a technology company like CRIO.
Rick, where is CRIO based, and what is its connection to Philadelphia?
Yeah, so I'm here in the Philadelphia area. I have born and raised and always have been. And CRIO is technically not headquartered in Philadelphia. Originally, the company was based up in Boston, but actually coming out of COVID, as the company was continuing to grow, they made a decision to become more of a virtual organization. And as they grew and expanded, especially expanded in the leadership team, evolved to a point where even though we're technically not headquartered in the Philadelphia area, one of our co-CEOs, Jonathan Andrus, my boss, is located here in the area. Our Chief Financial Officer, Sue Vestry, who I worked with in my time at Greenfire, was recruited in to be the Chief Financial Officer. So we've got a little bit of a leadership team presence here in the Philadelphia area. And of course, many of our clients are in this region as well. So I think we fit squarely in with the clinical technology companies that have a significant presence in this area.
So geographically, where is there critical industry mass within the clinical research space in terms of where many companies like yours are located?
Yeah, this may be one of the ways that I sort of, inadvertently benefited from falling into this clinical research space years ago, is that if you live in the Philadelphia area and you work in clinical research, there's always a lot going on, and there will always be opportunities, because this area we sometimes refer to as the Route 202 corridor from New York down through Philadelphia and Wilmington. A lot of life sciences, a lot of pharmaceutical, biotech, and specifically Philadelphia, a lot of clinical technology companies, for whatever reason, really have sprouted out in and around Philadelphia. So our clients, hotbeds in that Route 202 corridor. Certainly other areas like Boston is a bit of a hotbed, Chicago, the Bay Area, but New Jersey in particular, and this sort of region is home to a disproportionately high percentage of the sort of life sciences industry.
How are you presently funded?
Yeah, the company was privately founded, as I mentioned, almost a decade ago. And about a year ago, Riverside Company was the private equity firm that stepped in and acquired a controlling interest of CRIO, with the goal, as many similar private equity companies have, to take advantage of huge growth potential and help boost the valuation of CRIO. And they're only a year in. Typically, these private equity firms, in my experience, might hold on to an organization anywhere from 3 years up to 5, 6, 7 years. But it is a window of time that is in the mind of the PE firm. They see opportunity for tremendous growth, and they help fund that growth and direct and drive that growth. And then that in turn not only benefits the shareholders of a company like the Riverside Company, but also benefits the employees with career opportunities and growth opportunities along the way.
So what would success look like, you think, in 5 years for CRIO?
Yeah, well, that's a question I certainly should be able to answer, since that's really the primary focus of my role as Chief Commercial Officer, is to achieve that success. And you can certainly view it through a few different lenses. Obviously, to grow revenue, to grow market share, to expand as a business, to improve the valuation of our company. But again, the way that we also measure success in life sciences is the impact that we're having. And as I mentioned earlier, there's a really strong, pervasive belief within our company that what we're doing makes a difference in patients' lives by being able to facilitate the development of new drugs and therapies. And so I would say in 5 years, if in addition to growing commercially, we've also become more well-known and more adopted through the industry because of the contribution we're making, then I would say that would be the ultimate measure of success.
Rick, Charlie mentioned a short time ago that your father-in-law, Frank Maffei, was the last surviving member of Danny and the Juniors. What was the best memory that he shared with you about his time with the band?
Yeah, well, there's a bunch, and it's interesting within the work environment. This isn't a question I've received too often, but it's fun because my father-in-law Frank is a terrific guy. Actually lives with us now. I've been with my wife long enough. We've been married 28 years. I go back. I've met several of the other Danny and the Juniors folks before they passed, but my father-in-law, knock on wood, is doing well and enjoying life. And I'll tell you, for a guy who's generally soft-spoken, certainly more soft-spoken than myself, he has an amazing number of stories. And with all the years we've known each other, still manages to dredge up these anecdotes and stories that just blow my mind. And one he mentioned just the other night at dinner, we were talking about comedians. My son and I are a big fan of stand-up comedy, and he mentioned that when he was, I think, 18 or 19 years old in the early days of Danny and the Juniors, performing at these little clubs around Philadelphia where they would invite the rock bands to come in and perform before later some of the big comedians would get on stage. And I think it was Henny Youngman. It was certainly a name I was familiar with just through lore that made my father-in-law the butt of a joke by picking him up by his collar and kind of tossing him out the door in a little bit of slapstick humor because they knew each other in the show business. And I just sat there thinking to myself, well, I've been asked to leave a bar or two in my life, but never by a world famous comedian. So a heck of a story. And all it makes me think is, how do you sit there and listen to my boring stories when your head is filled with these really entertaining, phenomenal stories involving so many famous people over the years?
Henny Youngman, take my wife, please. I remember that was a favorite joke. What advice do you have, Rick, for folks who've been displaced by life sciences or technology companies in the Philadelphia region who may be trying to decide, whether to develop a company around the technology that they're familiar with?
Yeah, no, that's a really interesting question, because I have been blessed with meeting so many really interesting and brilliant people in this space over the years. And I've known some folks that have had a good idea and invested in it, rolled the dice in order to commercialize and turn that idea into a business. And some of them have been tremendously successful, not just financially, but as I mentioned earlier, in making a contribution and creating employment opportunities and all kinds of interesting things. I think for that reason, it's something that I would encourage someone with a really good idea to take a chance if you can and pursue it, because as rewarding as the last 20 plus years have been for me in this industry, it's also sobering to see the inefficiencies and the bureaucracy and the areas that still have so much opportunity for improvement in how we develop drugs in this industry. And so that provides a lot of opportunity for innovation and technology and new ideas. So I would say that if you have a good idea, give it a shot. And when you get to the point where you need help expanding and scaling up and commercializing it, you can give me a call.
Rick, when you look at the greater Philadelphia area in terms of sustaining a vibrant pharma and life sciences community, what do you see as the biggest challenges or perhaps the biggest opportunities for the region?
Yeah, there's no doubt that drug development, which has been a booming industry for decades and decades, has been going through some challenging times the last few years. There's many companies, like some of the ones I've been involved with, that have been fortunate enough to continue to grow and have success. But pharma companies are experiencing layoffs. Investment in biotech has dried up, both coming from big pharma as well as from private equity. And there's, at the same time, huge pressures in terms of global pricing for pharmaceutical companies, in terms of patent cliffs and so forth. So certainly a lot of pressures, a lot of concerns in the industry that create challenges, and I firmly believe that with those challenges lead to opportunities for innovation and technology and so forth. So I think for those of us that are in the business of getting creative, coming up with innovative ideas and pontificating those ideas, huge opportunity, because the industry needs that type of support now more than ever before.
Yeah, thank you.
So I want to go back to your time with your father-in-laws. We have a couple minutes before we close the show here, Rick. Has technology changed how his music is consumed with AI? Has he found things that are a new way to use the music, or has he found, God forbid, videos that they didn't create that AI has created?
Yeah, we chat about this topic quite a bit, and there's a couple of different considerations that come up. One is, as you might imagine, most artists are a bit concerned with the degree to which AI can be leveraged to create, quote unquote, create material, and what AI can do now in terms of, you know, generating for not just the sounds of a song or music, but the visuals, the video, everything can be generated by AI. And it does, I think, create anxiety for people who have made a career out of their creative art. But at the same time, technology has impacted him in a positive way. I mean, they stopped recording new music quite a long time ago. They did actually tour and do oldie shows for many, many years, well into his 70s. And I got a chance to go and see some of those, which was a lot of fun. My father-in-law was also involved, as many were from his generation, in lobbying Congress for fair treatment in terms of royalties and so forth. They came from an era where the artists didn't always get a fair shake in terms of the revenue they were generating, and he played a part in lobbying for reform, and because of that, he does receive royalties for the music that is out there whenever that music does get used. It's not exactly the foundation of our retirement plan, but it certainly comes in handy for a guy who's 85 and no longer out there producing new music. If a commercial, a TV show, a movie utilizes At the Hop, and occasionally they do, he gets a little bump in royalties and a check shows up without him really even knowing the details behind it. So that's technology driven. So there's, you know, like anything else, there's a good and bad to the growth of technology in any industry.
Rick, thanks so much. And please tell your father thanks for his part in this show, and hope to meet him someday soon.
Sounds good. I'll pass it along. Thank you, guys. Appreciate it.
Kimon, I want to remind our viewers that the next guest is Aaron Bennett of Bennett Financial. Bennett Financial is a fractional CFO company. I'm, again, very grateful to Kimon and to Tim Milloway and to Rich Whitfield, our producers and coordinator of all this for 15 years of 89 great episodes. I've enjoyed every one of them. Kimon, any final words before we ring off?
No, I'll echo what you said. Thank you to Tim and to Rich for all the years. I've really enjoyed it, Charlie. I'll miss doing this, but yeah. I think we're right to move on a high note. And Rick, thank you so much for being our final guest. You were terrific.
Yes, thanks so much. And I wish our viewers good evening, and thanks for their viewership all these years. Good night.